Hello everyone, my name is Katrina Michael and today I will be presenting an MSN evidence-based educational project on adults with diabetic ulcers secondary to diabetes. This presentation aims to educate those within this population images to lower the incidence of diabetic ulcers while also improving the amount of time it takes to heal the ulcer. The issue of concern here is the lack of education leading to further damage, with the goal being to lower the incidence of diabetic ulcers to improve the healing time by educating this population. Of course, there are multiple challenges faced, and we will be diving deeper into this as we go through this. Out of approximately 334 million individuals in the United States, 37.3 million of those have diabetes, and approximately 73,000 of those will undergo amputations at some point in their lifetime. It's important for us as advanced public health nurses to properly educate this population on primary preventative measures and efforts to prevent a diabetic ulcer. 15 to 25% diabetics develop a diabetic foot ulcer within their lifetime. New diabetic cases are found about 35.7 thousand per year. With the lack of education, the individual may not fully understand the instructions on caring for their wound, or the education given to them may be misinterpreted. If this is the case, the patient's wound could worsen as time passes. This makes them more susceptible to infections of the wound that could travel to their bloodstream or bone. This could then cause them to have an amputation or even possible death. This is why it's crucial as an advanced public health nurse to determine how well the patient can interpret the educational information provided, so as we as nurses can shape the education information into something they can better comprehend according to their literacy level. Alabama ranked number 8 as one of the most illiterate states with a 76.1 literacy score. Normally, people aged 65 and older have the lowest health literacy rates, and they're normally most embarrassed to admit it. So it's really important that we focus on those of those ages. There were 5 reviews of literature were performed, with the first on the evaluation of mortality risk factors in diabetic foot infections, the second on an update on prevention of diabetic foot ulcer, the third on the prognosis of the outcome of severe diabetic foot ulcers with multidisciplinary care, the fourth on the health literacy, knowledge, and self-care behaviors to take care of diabetic foot in low-income individuals, and the fifth on factors related to self-care behaviors among patients with diabetic foot ulcers. They all similarly focus on modifiable risk factors, health literacy, and self-care behaviors. A gap analysis was performed, and this is a method of performance to find gaps in performance and desired performance and develop strategies. The current state found was that 87.5% showed up for their appointment. The desired state was for 100% of them to show up for their appointment. The identified gap was a lack of knowledge and a lack of skills, and the methods used was direct observation. Missing appointments can create a massive setback for the patient because the wound needs to be debrided weekly for adequate healing. A SWOT analysis was also performed, and the found strength of the Marshall Wound Healing Center is that they offer treatment for a wide variety of wounds and treatment plans such as hyperbaric oxygen therapy treatment for diabetics. An identified weakness is the amount of space, the number of patients and staff. The increasing prevalence of diabetes and heart disease locally and nationally draws interest to this organization due to a significant percentage of individuals with diabetes and heart disease are the ones who develop wounds. Therefore, they seek out the wound center for help. Lastly, an identified threat is that with the increasing prevalence of diabetes and heart disease within our community and nation, the higher the number of those developing and suffering from wounds will continue to rise. A windshield survey assessment in Marshall County was also performed. The more popular parts of Marshall County were well manicured. Of course, we have a new movie theater and a park, as you see pictured here. We have two well-known museums. We have about 5 poultry processing industries. Pollution is a big concern here as pollution could become a significant issue as poultry processing plants are known to dump into rivers, which can cause pollution. We have two main hospitals, one located in Boaz, one located in Gunnersville, and combined they both contain about 240 beds. We have a 2-year college, Sneed State Community College, located in Boaz. Key leader and informer interviews were done. 2 registered nurses at a local hospital were interviewed. Um, Prevailing health needs for the population of interest identified during these interviews was education, glucose control, access to medical supplies, noncompliance with dietary recommendations. Concerns with this population during these interviews was risk of amputation and risk of high readmission. Issues found were high number of patients with noncompliance issues, possibly from enabling family members, and lack of follow-up on wound care. Assets of this population could be the wound care center due to the hyperbaric chamber. That could be a possible asset for the diabetics and advancements in diabetic medications and better access to dietitians. Lydia Hall's nursing theory supports the intervention and strategies for adults with diabetic ulcers related to diabetes, as these individuals highly benefit from being treated and viewed as a whole, which is what Hall's nursing theory does. If the patient feels cared for and treated exceptionally, they will be more likely to try to get better, or in this case, heal their wounds faster and better to manage their diabetes. This addresses the core area of Hall's theory, where patients set goals for themselves and behave according to their feelings and values. The social learning theory proposed by Albert Bandura, also known as Bandura's theory, also helps individuals understand how their environment and the people around them shape their behavior. There are 4 stages included within this theory: attention, retention, reproduction, and motivation. This theory is essential for psychologists, educators, and anyone interested in human behavior and development. This borrowed theory relates to the population of interest discussed, as the primary goal for this population is to lower the incidence of diabetic ulcers and improve healing time by educating those within this population. When educating someone, the next step is to learn the education given to them. The social learning theory is a borrowed theory that can help the individuals learn the education given to them. As you can see here, these are the environmental, individual, and agent factors. Environmental includes poor blood flow, nerve damage, infection, poor nutrition, smoking, alcohol use. Individuals, age, duration, diabetes, blood sugar control, overall health, obesity, high blood pressure, high cholesterol, history of smoking, and agents include type of wound care treatment used, type of dressing, and use of antibiotics. And you can just look over these. These are some primary, secondary, and tertiary prevention measures. Some primary prevention would be podiatry services and education. Secondary prevention would be like going to the eye doctor, heart doctor, early detection of foot changes. Tertiary would be the treatment of ulcer and to prevent amputation and offloading. Diabetes is a chronic illness with common complications that can lead to even death, especially in low-income populations with limited access to health care. Addressing health illiteracy and the lack of education in adults with diabetic ulcers secondary to diabetes and poverty-stricken populations is crucial for improving health outcomes. These individuals often lack access to health education and resources, leading to poor outcomes and increased risk of complications. The educational project plan focuses on 2 separate appointment interactions, with the first with the patient and family, which consists of conducting a survey, and then the second is where we take the survey and develop an educational pamphlet that includes primary, secondary, and tertiary measure information, as well as healthcare financial options. I also did a community focused where I handed out educational pamphlets at a local health department that's at a low literacy level as well. These are 3 community diagnoses developed from my educational project plan: risk of infection related to open wounds and factors that slow the wound healing process, knowledge deficit and self-care deficit related to the inability to understand instructions and education provided, non-compliance related to barriers to access secondary to financial issues as evidenced by verbalizing being unable to afford medication and the progress of the disease process. The population interventions of focus was to develop targeted education materials, to use plain language, provide visual aids, use teach-back methods, and provide additional support. An advanced public health nurse works within 5 sub-roles: the clinician, educator, advocate, manager, and collaborator. By using these sub-roles as an advanced public health nurse, I provided comprehensive care to patients with diabetic ulcers and promoted the goals of Healthy People 2030, which included reducing the incidence of complications of diabetes. Here you can see the measurable plan objectives of my educational project plan. Remembering the patient can recall basic information, understanding the patient can explain the relationship between the diabetes and the diabetic ulcers, making sure that the patient can apply the information that was taught. The patient can identify potential complications of diabetes, and that the patient can evaluate the self-care behaviors and identify areas for improvement, and the patient can develop a self-care plan for themselves. This slide contains the resources needed along with the budget and timeline. Here are some barriers and challenges faced during my educational project. I prioritize patients, families, and the community during this project implementation. I engaged families to create a supportive environment for patients and distributed pamphlets to increase community understanding of diabetic ulcers. My goal was to empower individuals, create support, and promote better management of diabetic ulcers. My self-reflection on the project, my lessons learned, the resource allocation, collaboration, and strategic planning. I developed a deeper understanding of the challenges and opportunities faced. The evaluation emphasized patient education, family involvement, and community education. During the project evaluation, I thoroughly assessed the impact of our initiatives on patient education, family involvement, and community engagement in managing diabetic ulcers. The findings highlighted the positive outcomes and benefits experienced by patients, families, and the community. And here I identified the areas for improvement, expansion in different healthcare settings with diverse populations, and of course, resource allocation, strategic planning for sustainability and success. Looking towards the future, this project can be used in various settings with different populations. Sharing experiences and lessons learned can benefit others in replicating or adapting the project. In conclusion, this project can be used in various settings. The materials and strategies can be adapted to be used in different clinics and hospitals. Sharing experiences and lessons learned can benefit others. And thank you for taking the time to listen to my narration. I hope you were able to take away important information from this educational project. Thank you.